Okay, I think we have most of our participants, so we are going to get started. So hello, everybody, and welcome again to our session today, which is presented in partnership with Ovarian Cancer Canada and CancerCare Manitoba. My name is Stephanie Goslin, and I'm the Programs Director with Ovarian Cancer Canada. Again, I'm going to introduce Michelle Elwood. She's the gynae cancer patient and family educator with CancerCare Manitoba. She is also on the Lunch and Learn today. I've been thankful to have had the opportunity to work with Michelle for the last several years. We've had a great partnership and we've been able to do several workshops in person, and super happy to be collaborating again this spring with our Lunch and Learn series. We had our first session last week. Today is our second event in our Lunch and Learn series. So we are going to get started, and excited now to introduce you to our speaker for the session today, Robin Chambers. Thanks, Robin, for joining us. Robin holds a Bachelor of Human Ecology degree from the University of Manitoba, and she completed her dietetic internship at the Health Sciences Center in Winnipeg. She is a registered dietitian and a member of the College of Dietitians of Manitoba. Robin joined the team at CancerCare Manitoba over 18 years ago after working in private practice, and she specializes in providing patients with nutritional counseling throughout their cancer journey. I've had the pleasure of hearing Robin speak before. Everyone, you're in for a great session today. And again, I tell you to please use Robin's expertise. And if you have any questions, please post those in the Q&A at the bottom, and we will get to those at the end of the session. So with that, Robin, I'm going to turn it over to you.
All right. Thank you so much, Stephanie. And good afternoon and welcome, everybody. It's really a pleasure to be part of this Lunch and Learn series for women during or after gynecological cancer treatment. So with that, we're going to get started, and I'm going to share my screen. Now it says the host disabled participant screen sharing. So Stephanie, can you allow me to share the screen there?
You bet I can. Sorry, everyone. We had practiced this before, but it came off. There you go, Robin.
There we go. All right. Okay, so everybody can see that now?
We can see it. Yeah, looks great.
Okay, perfect. So this afternoon, we're going to be talking about bowel health, and specifically improving your bowel habits through diet. That may require modification to your diet based on your bowel function while you're going through treatment and beyond. And as Stephanie mentioned, I've had a lot of experience working as an oncology dietitian at CancerCare Manitoba, and a good part of my practice has been helping patients deal with bowel issues. So I'm going to be drawing on some of my own experience, and as well, I'm hoping to help you navigate through some of the diet guidelines that I admit can sometimes be a little bit confusing. All right, so this is what we're going to be talking about this afternoon. I keep referring to that term bowel. And so we're going to start off by actually identifying exactly what is the bowel, what we're referring to. We're going to talk about what it means to have good bowel function, and then take a look at some of the common bowel problems in women with gynecological cancer, and that's both during and after treatment, and then how we can manage these common bowel problems with our diet. So we're going to look at things like constipation, bowel obstruction, diarrhea, and abdominal gas and bloating. Now, bowel health it's a huge topic to undertake, and so I want you to keep in mind that these are really general guidelines. At the end, as Stephanie mentioned, I'm hoping to answer or try to answer any questions that you might have. But I want you to always keep in mind that your specific case may need individualized nutritional counseling. All right, so what is the bowel? This picture that you see here shows us the anatomy of the GI system, which is short for gastrointestinal system, or it commonly referred to as our digestive system. And it starts from the mouth, where of course we take in food or drink, and then it extends all the way down to the anus, and that's where stool or waste leaves the body. And our GI system also includes accessory organs like the pancreas, the liver, the gallbladder, but we're going to be focusing on the lower GI tract, or commonly referred to as the bowel. So this includes two parts. We have the small intestine, or the small bowel, and then the large intestine, otherwise referred to as the colon. The small bowel is where we absorb or take in nutrients that we get from food. And then those leftover nutrients that our body doesn't use, it moves on to the large intestine. That's where water and minerals or electrolytes are absorbed into the body for use. And that's also where body waste is formed. And we refer to body waste as stool. And then we carry on from the large intestine into the rectum. That's at the end of the colon where stool is stored until a bowel movement occurs. And then stool leaves the body through an opening called the anus, which helps control our bowel movements. So what's considered good bowel function? Basically, it means that our body waste or stool is usually medium brown in color. It's usually soft and formed and easy to pass or get out. Normal really depends on the person. So a bowel movement should happen on a regular basis, for example, every day or every other day, but that normal frequency is going to be different for each person. And it's often related to how much you eat. If you're generally eating 3 meals a day, you should expect a bowel movement on a daily basis. If for whatever reason you're eating less than normal, let's say you're going through treatment and you've got a poor appetite, or you're not eating as much as you usually do, then you may expect a bowel movement every other day. Cancer can absolutely change your normal bowel patterns or your normal bowel function, depending on the type of cancer that you have or what treatment, what kind of treatment you're receiving. Now, on the right side of the slide is a diagram of the Bristol stool scale, or the Bristol stool chart. Now, what I like about this chart is that it uses kind of common descriptive language describing stools, and it identifies 7 different types of stools. So type 3, 4, and 5 there are considered normal, and we can see a good visual of that and descriptive terms. Type 6 and 7 at the bottom of the screen describes diarrhea. So we can see here that these are not formed, they're quite loose and can actually be very liquidy or watery. And then type 1 and 2 describes constipation. So when you're talking to your healthcare team, they're going to ask you, I'm sure you've all been asked questions about your bowels and to describe how frequent, what they look like. And so this little chart is something that certainly you could refer to. So let's start talking about constipation. And essentially what constipation is a small, hard, or dry stool that is difficult to pass. Essentially, it's the slow movement of the stool that's going through the large intestine. So the longer that stool is in the colon, the more water that the stool loses and the harder it becomes. Usually constipation is associated with irregular or infrequent bowel movements, certainly less often than what is normal for you. It's often associated with cramping or pain and discomfort. You can have bloating, gas, early satiety, which basically just means you get full quickly. You might experience a bit of reflux or heartburn, and you also might experience some nausea as well, and sometimes vomiting. Constipation is a common symptom in women who have been diagnosed with gynecological cancer, and certainly it can be a side effect of treatment. And the other thing about constipation is it can be classified as occasional. So you might be constipated for a few days, let's say right after your treatment, or certainly it could be something more chronic in nature, which is going to last for a much longer period of time. So there's many causes of constipation. Certainly what medications you take can contribute or cause constipation. Certain chemotherapy medications, for example, paclitaxel, which is used to treat ovarian cancer, it can cause some constipation. It can also cause some diarrhea too. But probably one of the biggest reasons or one of the biggest causes of constipation is pain medication. So if you're on any opioid medication, T3s, codeine, morphine, hydromorphone, these medications slow down the gut, and you're likely to experience constipation with those. Some anti-nausea medications, for example, ondansetron, can be quite constipating. And certainly there's a long list of medications that can cause constipation. Eating a low fiber diet certainly contribute, or if you're eating less. As I mentioned, if you're eating less, often you're having less frequent bowel movements. Now, sometimes I have patients say, they haven't had a bowel movement for a really long period of time. And they say, well, I'm not eating, so that's normal that I'm not having a bowel movement. Well, our body still does produce waste. So even if you're eating very little, you still need to be moving your bowels. Another common cause of constipation is if you're not drinking enough fluids. So that's probably one of the first things that you're going to be asked, how much you're drinking. If you're less active, that also slows down the bowel. Certainly bowel disorders that you may have had prior to a cancer diagnosis, IBS or diverticulitis can cause constipation. That's usually more chronic constipation. Tumors may prevent or slow down the passage of stool. And there's even a psychological component when we're talking about our bowels. Depression or that psychological component can certainly disturb our brain-gut communication, and that can make constipation worse as well. So when we're looking at managing constipation, there's quite a number of steps that you can take. The first one is making sure that you're getting enough fluid. You want to aim for a minimum of 6 to 8 cups of fluid per day, and that can include a variety of fluids. It's not just water, so even soups or watery foods can contribute to your fluid intake. By increasing your physical activity, walking, for example, can really help keep those bowels moving. And medications or laxatives, those really play a very important role in managing constipation. And your healthcare team is going to help you or tell you which laxatives might be right for you based on your symptoms and what your stools look like. The most common one that's recommended is usually Restoralax. And that's what we call an osmotic laxative because it draws liquid or fluid into the colon and it allows the stool to be passed easier. It keeps the water in the bowel longer to soften it. And the ingredient that you're looking for, there's a number of different osmotic laxatives, things like Restoralax, Laxate, Clearlax, Miralax. They all contain that active ingredient called PEG or polyethylene glycol. Lactulose, the Restoralax of the PEG is a powder. So you would be adding that to hot or cold liquids and take it that way. Lactulose is another osmotic laxative, and that's a liquid form. And then there's stimulant laxatives that probably a lot of people might be familiar with. That's the Senas or the Senacots. And these stimulant laxatives increase muscle contraction. So they help the stool move through the digestive system. Sometimes people find that these are a little bit irritating. They can cause a little bit of abdominal discomfort, but they definitely do help push the stool out. And then a third laxative that is sometimes used is called Dulcolax, and that's both a stimulant and an osmotic laxative, and it can be taken in pill form. The one thing that I want to emphasize that if your constipation is caused by taking pain medications, it has to be treated with laxatives. I know some people think, oh, I'll just increase the fiber in my diet or drink more water. But really, you need to make sure that you're on a regular bowel regime. And again, that's going to be directed by your healthcare team. And sometimes you actually need to take higher doses than what it actually says on the box to manage constipation if it's caused by that pain medication. Don't take suppositories or enemas unless, of course, that's prescribed by your doctor, because that can cause harm, particularly if you are on treatment. And the important rule of thumb here when we're talking about medications is that you need to take them as directed in order to prevent constipation. And what I find often happens is that you start to, the bowels start to finally move. They might be a little on the looser side, and then people right away back off, or they stop taking the laxatives. And then you end up with constipation again, and it kind of starts this vicious cycle. So instead of stopping the laxatives completely, you may need to just adjust the dose to find that right balance. All right, so we talked about increasing fluid, increasing activity if possible, taking your medications regularly to keep your bowels moving. We can also take a look at the diet. Now, I want to preface this by saying, if you are not at risk for bowel obstruction, and we're going to talk about that in a minute, about what that is, but if you're not at risk for a bowel obstruction, it might be beneficial to increase dietary fiber, that's fiber, of course, that's coming from food, in your diet. And you can aim for about 25 grams per day, but you want to do this slowly as tolerated. If you increase the fiber too quickly in the diet, that can cause some gas and bloating, or even possibly diarrhea. So here's some examples of some high fiber foods that might keep your bowels moving more regularly. Things like berries, grapes, high fiber cereals. Those would be cereals that have more than 2 grams of fiber per serving. Legumes, these are your dried beans, peas, lentils, things like popcorn, whole nuts and seeds, apples with the skin on, and avocados. So those are just a few examples. Other tips that will help manage constipation include a natural laxative recipe that we often provide to patients. It's made of prunes and raisins and dates, and it's kind of like almost like a marmalade. You cook it, and it can be added to toast or in oatmeal or in yogurt. If you're interested in that recipe, I can certainly provide it. Another thing that I find that people find useful is by drinking about half a cup of prune juice first thing in the morning. That can sometimes help get the bowels moving. It's really important that you adapt kind of a daily routine. I find that starting the day off with a really high fiber cereal and then drinking a hot beverage afterwards can certainly help stimulate the bowel. You could also try a probiotic yogurt or kefir with live cultures. Kefir is a fermented milk drink that's similar to yogurt. The one thing I really want to emphasize here is that you shouldn't take fiber supplements, things like Metamucil, psyllium husk, benefiber. They could potentially make constipation worse because these fiber supplements tend to increase the size of your stool. Now, sometimes they are appropriate to take, so that's something to talk to your healthcare team about, but only take them if your healthcare team prescribes those. And again, as I mentioned earlier, the key to managing constipation is prevention. If you're not treating constipation, it can become severe, and that can lead to further complications like impaction, which is the accumulation of dry, hardened stool in the colon. And it's much easier to prevent constipation than it is to relieve it. As always, you need to report to your healthcare team if you have not had a bowel movement in more than 2 days, or if you start to have liquid diarrhea, because that could be a sign of impaction or other problems. All right. So constipation and impaction, it's not the same thing as bowel obstruction. And a bowel obstruction is a common complication in gynecological cancers. And it's a blockage which prevents undigested food, liquid, or stool from passing through that small or large intestine. Now, the cause of bowel obstruction is typically because there's a narrowing in part of the bowel or the intestine. And that might be because of inflammation, particularly if you've been treated with radiation. It could be because there's pressure from fluid in the abdomen. If you've got extra fluid around your belly, that could be pressing on the bowel, causing a narrowing. Tumors, both inside or outside of the bowel, can cause a narrowing. And certainly scar tissue or adhesions from surgery can potentially increase the risk of a bowel obstruction. Most bowel obstructions occur in the small intestine, about 80% actually, but 20% do occur in the large intestine as well. And a bowel blockage or an obstruction, I should say, could be partial. So that's when you'd have that narrowing, so things are more difficult to pass through, or you could experience a total and complete bowel blockage or obstruction. And this, unfortunately, is a common complication with ovarian cancer, particularly in advanced or recurrent disease. So this diagram really illustrates what a bowel obstruction can look like. The obstruction could be caused by a tumor growing on the inside of the intestine. So that first picture that you see on the left-hand side there. And in this case, that obstruction is actually a complete blockage. And then the other two examples on the right-hand side, this is actually a tumor or a tumor nodule that's pressing on the outside of the intestine or the bowel. So again, in advanced cancer or in the case of recurrence, sometimes these tumor nodules or these small tumors throughout the bowel can grow on the thin membrane that surrounds that bowel wall. And again, that's causing that narrowing, so undigested food or stool has a difficult time passing and can cause symptoms. So some of the symptoms of a bowel obstruction, I've kind of classified it as chronic or partial obstruction. These may last, they may come and go, they may last for short periods of time. And those would include things like increased gas, bloating. So if your stomach feels full or quite swollen, it could be, you could experience cramping, feeling full quickly with meals, heartburn or acid reflux. Usually there's some nausea that you might experience. And sometimes you're going to experience some diarrhea because this isn't a total blockage, it's partial. So sometimes that formed stool can't pass through. And so you end up with more liquidy diarrhea. Or in some cases, you might notice that your stool has a much thinner caliber, so almost like a pencil-like formation. Severe symptoms, and this certainly occurs if you have a complete obstruction, if you're fully blocked. If you don't have a bowel movement for more than 2 days, particularly, of course, if that's different than normal, if you're not passing any gas at all, definitely a bloated stomach, pain, nausea, and often vomiting is a symptom of a complete blockage as well, particularly after you eat something, it comes back up. If you're experiencing severe symptoms, if you're taking laxatives, you should stop taking those and contact your healthcare team immediately or go directly to the ER. And there's different ways to manage bowel obstructions. Conservative management, which means the obstruction resolves on its own, but sometimes that requires having a nasogastric tube put into your stomach and pumping liquid out. And then you start, usually you're not drinking or eating anything, then you start on clear fluids and then eventually go back to usually a low fiber diet, I'm going to talk about. Sometimes surgery is required. Sometimes part of the bowel that's affected is removed, or sometimes it's bypassed. And certainly if the obstruction is being caused by adhesions or scar tissue, sometimes that can be repaired through surgery as well. And sometimes stenting can be helpful. Sometimes that happens. A stent is a wire mesh tube that is placed and holds open that blocked area of your bowel. All right, so for chronic or more milder symptoms of, let's say, a partial bowel obstruction, usually you can manage those with dietary changes, laxatives, and even physical activity can play a role here. So these are some tips that might help prevent an obstruction in some women, or may help decrease or lessen or ease your symptoms. So these basic guidelines would include chewing your food well. You know, from the moment that you put food in your mouth, right away digestion starts. So those enzymes start to break down the food, but the mechanical process of chewing is also going to start digestion and break down the food more easily. Eating in a relaxed setting, I say that because really trying to reduce overall stress is really important, and eating slowly. Eating smaller amounts of food more often throughout the day. So you don't want to be eating large meals because sometimes just the sheer volume of food that you're eating, it can make it difficult to pass. Drinking enough fluids. So again, making sure that you're drinking at least 6 to 8 cups of fluid a day. That's very important. Here you do want to limit foods that contain caffeine or alcohol because they do tend to irritate the bowel. Now, the other thing, of course, which can be helpful is consuming a low fiber diet. Fiber in general adds bulk to your stool, making it more difficult to pass when you're at risk for an obstruction because fiber doesn't digest. So consuming a lower fiber diet may help your symptoms, and that means avoiding skins and seeds from vegetables and fruits, avoiding leafy greens, so that means no salads or raw vegetables, avoiding whole nuts or seeds, dried fruit, legumes, those are your dried peas, beans, and lentils, popcorn, and whole grains. I want to just mention about juicing and smoothies. If you are using a juicer, you want to make sure that you're separating the pulp and you're removing the pulp because that's, of course, where the fiber is located. If you're doing smoothies, that means you're blending ingredients. You're adding whole pieces of fruits and vegetables in the blender. So it's going to be very important that you're only adding 1 or 2 servings of lower fiber fruit. And I will be talking about that in a minute. You want to avoid any food that's really tough or stringy. So things like celery, mango, tough meats or meats that have a lot of kind of bristle in them. Avoid the casings of sausages and deli meats. And again, critical here, do not take fiber supplements because again, they increase the size of the stool. Now, some women are going to be able to tolerate, higher fiber foods. It's really about balance, and it's all about your own individual needs and what you're able to tolerate. Usually we say with the diet, we talked about constipation, trying to get 25 grams of fiber in a day. But when we're talking about a low fiber diet, we're cutting that fiber in half. So usually we're looking at about 10 to 15 grams of fiber a day. And usually that is tolerated in most cases. So when you're out shopping, one thing that's really beneficial is reading food labels. And this is really helpful to see how much fiber is in a food product. And it also can be used to compare similar products. So here we've got cereal A and cereal B. The first thing you want to look at on a nutrition label is what the serving size is. So if we're taking a look at cereal A, we see that the serving size is half a cup. And in that half a cup, you're actually getting 7 grams of fiber. And that's 28% of your daily value. We want to be looking for food items that have no more than 2 grams per serving. So this would be a cereal that you would want to avoid. If you take a look at cereal B, you can see that the serving size is actually larger. It's 3/4 of a cup, but there's only 1 gram per serving, or 4% of that daily value. So again, you're looking for items under 2 grams per serving and no more than 5% of the daily value. Something that I find that's really helpful for women who might be at risk for bowel obstruction or experiencing symptoms is to keep a food journal. So writing everything that you're eating and drinking, quantities, when, how much, and then also noting any subsequent symptoms that you might be having. So that really helps you kind of associate what foods might be triggering symptoms. Make sure that you take, again, I know I keep emphasizing this, but make sure you take your bowel medications as directed. That's going to help keep your bowels soft and make them move. Remember, you're eating less fiber, so you often need to add those bowel medications in so that the bowels keep moving. If you are restricting your diet, you're not able to eat all of those high fiber foods, maybe some certain fruits and vegetables, and that's why I often suggest or recommend taking a regular 1-a-day multi or mineral vitamin supplement. Take that with food. I often recommend a chewable one so that, again, it's kind of easier digested and absorbed. You can also get liquid supplements as well. And then the other thing, staying active, that's really important as well. All right, we're going to switch gears now. After talking about constipation and bowel obstruction, we're going to look at the other end of the spectrum and talk a little bit about diarrhea. Certainly, this can be a significant symptom burden for women with gynecological cancer. The effects can be quite physically and emotionally draining, and they can really range anywhere from just being a mild nuisance to really a debilitating dysfunction. The prevalence and the severity of diarrhea really varies depending on the type of cancer treatment that you've had. So the simple definition of diarrhea here is just simply frequent bowel movements with liquid stool. Usually it means an increase of 3 or more stools per day compared to what's usual or normal for you, or an increase in the liquidity of the bowel movement. It might be associated with bloating and cramping. Diarrhea can absolutely put you at risk for dehydration. And if you get very dehydrated, that can lead to kidney problems. It can cause electrolyte balance. And by electrolyte, we're talking about sodium and potassium. It could lead to unintentional weight loss. Certainly, it can make you feel very fatigued and tired. There can be some malabsorption with nutrients, possibly malnutrition. Some women will experience incontinence and skin irritation, depending if you are having very frequent bowel movements, and also a decrease in the quality of life. And by that, I mean, it can interfere with your activities of daily living. You're afraid to leave your house, you can't go for a walk, and you can never be far from a bathroom. Diarrhea could potentially lead to a delay in treatment, a dose reduction, and in severe cases, a discontinuation of your treatment. And it can be also characterized as acute, so that might be for longer than 4 days or for less than 2 weeks, 2 or 3 weeks. And certainly some women do experience more chronic diarrhea, and that's usually if you're still having diarrhea over 2 months. So the most common cause of diarrhea in gynecological cancer is cancer treatment. And the most common one, of course, is radiation to the pelvic area. And that's because of the close proximity to the GI system, to our bowel. More than 70% of women are going to develop diarrhea with radiation, especially if you're also receiving chemotherapy at the same time. Radiation to the pelvis can cause something called radiation enteritis. And that's a condition where the lining of the intestine becomes inflamed and swollen as a direct result of your radiation treatment. It can happen during your treatment, and it can also happen after you've completed your treatment. The small and large bowel are very sensitive to radiation, and those healthy cells, unfortunately, are damaged with your treatment. Usually the diarrhea starts after the first week of treatment, and usually there is improvement after a couple of weeks once your treatment has been stopped, or once you've completed your treatment, but it could potentially last up to 8 to 12 weeks after your treatment. And there is a small percentage of women who will go on to experience more chronic problems. And that could even present months and even years after your treatment has ended. So besides radiation, chemotherapy can also cause diarrhea, and also immunotherapy may cause diarrhea as well. Medications that you might be taking, in particular things like magnesium. If you're on treatment, sometimes you develop a low level of magnesium and you're being told to take magnesium supplements. Sometimes you even get magnesium through the IV, and that can absolutely cause some diarrhea. Some of the anti-nausea medications we mentioned on Dancitron being constipating, but things like Maxaran or metoclopramide, that's a nausea medication that could cause some diarrhea. Certainly, if you are on laxatives or stool softeners, you could develop diarrhea from that. Antibiotics kill our normal healthy gut bacteria in the colon, and that can be a cause of diarrhea, and maybe even other medications that you might be on. If you're a diabetic and you're on metformin, common side effect of metformin is loose or watery bowels. Infections can also cause diarrhea, things like C. diff or E. coli, certain food intolerances. If you're lactose intolerant, that's the natural milk or sugar that's found in milk and dairy products. You may not be able to tolerate caffeine or sugary drinks, high fiber foods, high fat foods, or spicy foods. And I've mentioned before that stress and anxiety can absolutely have an effect on our bowels. Whenever possible, one of the ways, in order to treat the diarrhea, we want to try to determine what is causing it. So in terms of managing diarrhea, the first and primary goal is to make sure that you don't become dehydrated, that you're drinking plenty of fluids. Now, prior, I was saying, aim for 6 to 8 cups of fluid, but if you're experiencing diarrhea, you need to replenish the fluid that you're losing through your stool, and you want to be aiming closer to 8 to 10 cups. And if you're having a lot of diarrhea, you may have to increase that by an additional cup every time that you're moving your bowels. Fluids will include water, flavored waters, and those are sugar-free flavored waters. Often if water is a difficult thing for you to drink, I'll suggest slicing up lemon, lime, even cucumbers. Or you can buy the little Neos or Crystal Lights where you squirt one or two squirts in, can flavor up that water. Herbal teas that are non-caffeinated, things like broth and consomme, vegetable juices. You may need to replace electrolytes if you're having a lot of diarrhea. So that's sodium and potassium. One of the easiest ways to increase sodium, of course, is just to use the salt shaker. And also for potassium, eat foods that are high in potassium. So those would be things like bananas, potatoes, tomatoes, sweet potatoes, beets, and watermelon. If it's suggested that you use an electrolyte replacement drink, you could use something like G2. That's part of the Gatorade family. G2 has half the sugar that the regular Gatorade has, but it doesn't have quite the amount of salt. So we suggest adding 1/8 of a teaspoon of salt to a liter of fluid. And then there is that homemade electrolyte drink that I've got posted there. Certainly that's something that you could try as well. I find that the homemade drinks are not quite so sweet. When you're drinking your fluids, they're best taken at room temperature. Anything really hot or really cold is going to stimulate the bowel. Another little tip is to separate your liquids and solids. So try not to drink more than about half a cup with your meals, because if you're drinking and eating at the same time, that speeds up digestion and speeds up that transit time that food is in your gut. Sip slowly but constantly throughout the day. Always have a glass by your side or a water bottle. Avoid alcohol and caffeinated beverages and gas-forming beverages. Those would be a lot of pop, or even some of your carbonated, basically any carbonated beverages. And limit sweetened beverages. That includes things like juice, It includes things like some liquid nutritional supplements like Boost and Ensure, and regular Gatorade or Powerade. There's too much sugar in these products, and if you're drinking them, they could actually make the diarrhea worse. All right, so I'm gonna just speed up here. I realize time is ticking, and we still have quite a bit of information to cover, but I mentioned that the first goal of treating or managing diarrhea is to make sure you're drinking enough fluids. In addition, the second goal is to try to decrease the demand on our bowels. So by eating smaller, more frequent meals and snacks every couple of hours throughout the day, managing your fiber intake, and I'm going to touch again on that, limiting those gas-forming foods, avoiding foods that are really greasy or fried, avoiding a lot of spicy foods, trying lower lactose containing foods, and so that's your milk and your dairy products. So again, lactose is that natural sugar that's found in milk and milk products. And sometimes when our intestines are damaged by radiation, you may not be making enough of the lactase enzyme that's needed to digest the lactose. Most individuals can tolerate small amounts. The good thing is there's substitutes that you can take. So you may want to swap out your dairy milk for soy milk. Or you can certainly buy milk where the lactose is removed. So there's lots of lactose-free options out there. Basically, you want to avoid foods that are going to make any symptoms worse. And then once your diarrhea is resolved or your symptoms improved, then you can start reintroducing foods that were eliminated back into your diet one at a time in small amounts so you can assess the tolerance. All right, I just want to touch on fiber, dietary fiber. And basically what it is, it's the undigested part of plant foods. It is considered a carbohydrate, and basically we are unable to digest it. Fiber plays numerous roles and functions in our body. However, it's important to realize that it's something that's not essential. So I know when I see patients in my practice and they're told to follow a lower fiber diet, that can create a lot of stress, because especially if they're used to eating fiber, or they feel like, well, I need fiber in my diet, it's good for me. But the good thing to know is that it's not essential. And if you are being prescribed a lower fiber diet, it's because we're trying to manage other symptoms and complications. Fiber is divided into two different types: insoluble and soluble fiber. It's the insoluble fiber that may worsen diarrhea in some individuals. Oops, sorry. So these are foods, and these are things that you want to limit or avoid, things like wheat bran, high fiber cereals, nuts and seeds, popcorn, corn, your cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, kale, your legumes, your green leafy vegetables, dried fruits like prunes, berries, and raw vegetables. You want to remove skins, seeds, and membranes from the fruits and vegetables. And keep in mind that chopping, cooking, canning, or even blenderizing these foods do not necessarily decrease the fiber content. So then we have soluble fiber, and soluble fiber might in fact be helpful in reducing diarrhea because it's gel forming. It acts as a binding agent to produce a more solid or thicker bowel movement, and it should be added to your diet on regular intervals throughout the day. Here's some examples of soluble fiber: ripe bananas, applesauce or canned fruit, peeled fruit without the skin or membrane, so really the fleshy part of fruit, potatoes or sweet potatoes, oatmeal or oat bran, really anything made with oats, barley, tapioca, canned fruit, I already mentioned that, white rice, cooked carrots, and chia seeds. Another example of soluble fiber is psyllium fiber. Now, this is the active ingredient that's found in Metamucil, and it absorbs water and it expands as it travels throughout the GI tract, and it helps thicken up the stool. So make sure that you talk to your healthcare team about that. It might be something that's beneficial for you. But again, I do caution you about taking this without the direction of your healthcare team. All right, so how do we put this all together? I've had people say that, or women say, I'm supposed to cut out the fiber in my diet. What can I eat? So when you're planning a meal, one of the first things that you want to do is to include a protein source. We know that protein is very important for healing and repairing body tissue. This is especially important while you're undergoing treatment. So some of these low fiber food choices that are excellent sources of protein are well-cooked, tender meats, poultry, fish, eggs, creamy nut butters. Hummus is tolerated in small amounts. Soy foods like soy milk or tofu, cheese, and yogurts. So you start with that protein, and then you want to pick a low fiber carbohydrate. And carbohydrates are your grains and your starchy vegetables. So that would include things like oatmeal, cream of wheat, barley, just a minute here. Getting ahead of myself. All right. Most of the time, women can manage 60% whole wheat bread, so you don't have to just eat white bread. Rye bread is another option. Sometimes you'll want to take the crust off that if it's really tough. Pasta, white, and in some cases, small amounts of brown rice might be tolerated. Your low fiber cereals, your potatoes, and yams. And then you're going to choose 1 to 2 servings of low fiber vegetables. So make sure you remove the skins and the seeds. And here's some examples of low fiber vegetables: the asparagus tips, carrots, peppers, squash, zucchini, tomatoes, tomato sauce, cucumbers. There's a whole list there. Definitely, I find that some women tend to manage vegetables. It's easier to digest when they are cooked, but you could include a cucumber tomato salad if you're removing those skins and seeds. And then your fruit, again, removing skins and seeds, ripe bananas, applesauce, melons, peeled apples, pears, peaches, plums, papaya, and canned or cooked fruit. And then, of course, adding fats, healthy fats to your diet. That can include butter, margarine, oils, and mayonnaise. Really, it all comes down to individual tolerance. All right. So besides eating a lower fiber diet, the standard of practice really in managing diarrhea is taking Imodium. So again, that's something to talk to your healthcare team about, to get instruction exactly how to take that. If the Imodium isn't working, there are potentially other medications that you can take. And I just want to touch briefly on probiotics, because this is something that I get asked a lot in my practice. Probiotics are that good bacteria. Sometimes they're referred to friendly or healthy bacteria that live in our colon or our gut and can help improve digestion. Besides supplements, they're most commonly found in yogurt or kefir that contain live and active cultures, as well as fermented foods. The research does indicate that probiotics may be helpful with IBS or diarrhea that's caused by antibiotics. And we know antibiotics kill the healthy bacteria in our GI tract. Radiation and chemotherapy also kill that healthy bacteria. Having said that, really more research is needed here to determine the timing and the dosing and the type of probiotic that might be beneficial. I do want to emphasize that we don't recommend probiotics for women who are on active treatment. And that's because usually your immune system is compromised. And whether it's a healthy bacteria, we really don't want to introduce any extra bacteria in that supplemental form, because it could increase the risk of infection. A lot of attention is played on probiotics, but you don't hear as much about prebiotics. And prebiotics is fiber. It's the non-digestible part of food that actually feed the healthy and friendly bacteria that's already in your gut. Some examples of lower fiber prebiotics would be things like asparagus, bananas, tomatoes, onions, garlic, and oats. So this is a really complicated topic. We don't know all the answers, but I did want to touch on that. All right, the final thing that I want to touch on is abdominal gas and bloating, because this is something that's commonly seen. The terms are interchangeable between patients and caregivers. Gas may be produced by bacteria in the bowel or by taking air during swallow. 90% of air or of gas in our bowel is air that we actually swallow. Gas in the small bowel can result from malabsorption of nutrients like carbohydrates that provide a natural environment for bacterial fermentation. Bloating is considered that sensation of excess gas or fullness, or abdominal hardness or tightness. And distension is associated with an increase in abdominal girth. So if you find that your belly's getting larger as a result of increased gas, sometimes that might be caused by fluid. Gas and bloating is common in IBS and malabsorptive disorders. And again, it's a common side effect of chemo, radiation, and in gynae cancers. So a couple tips: avoid swallowing by limiting straw use, avoid carbonated beverages or chewing gum, eat slowly, chew thoroughly with your mouth closed, and sip on your beverages. Don't gulp them down. Eat at regular intervals. You can try a low lactose diet. That may be helpful. Avoid cruciferous vegetables, so onions, garlic, legumes. You could try something like vino, which may help with that. Avoid certain fruits, sugar alcohols. If you're consuming any kind of sugar-free products, these sugar alcohol, look for those ingredients. They are very gas producing. You could try something like simethicone. That's the active ingredient found in Gas X and Oval. And keep your bowels moving, manage your constipation. All right, well, that takes me really to the end of my presentation. Just to close, I want to highlight the nutrition services at CancerCare Manitoba. And for those of you who are joining us from Saskatoon or Saskatchewan, nutrition services are also available to you at your cancer center in Regina and Saskatoon. Again, if you're experiencing a lot of difficulties with your bowel, nutritional support really can play an important role there. You will get individualized nutritional counseling, and you don't need a referral from the healthcare team. You can self-refer. The contact information is there. And with that, with 5 minutes to spare, I am going to stop sharing these slides and end off there. And sorry about that. That took a little longer than I expected.
No, you know what? It's all great information. And we do have quite a few questions. So I'm going to get rolling and we're going to get through as many as we can. And if we don't get to your question, we will, please feel free to reach out to myself or Michelle or Robin, and we will try to get those questions answered for you. So first question, and you may have answered this in the presentation, but I'm going to ask again just for a refresher. Can sugar also cause constipation?
Actually, usually, and I mean, I'm not sure what exactly is meant there by sugar. It's not something typically that causes constipation. I would say more so if you're drinking a lot of sugary drinks, things like juices, and that can actually cause diarrhea, or it might actually help move your bowels a little bit. So I don't know of an exact link where sugar specifically. I think you need to look at the whole diet. Looking at one little aspect, I would say we couldn't probably pinpoint and say that sugar causes constipation.
Okay, thank you. Next question. I'm curious as to whether the type of fiber makes a difference, i.e. insoluble versus soluble.
Absolutely, particularly when we're talking about diarrhea. So you want to avoid foods that are high in insoluble fiber. They work differently in our body. So that insoluble fiber we don't digest, and it can make diarrhea worse. But soluble fiber works differently in that it actually gels the stool. It takes in fluid and it kind of bulks up or gels the stool, so it can help with diarrhea. If again, I'm not sure if we're talking about constipation or diarrhea. When we're talking about constipation, certainly increasing both insoluble and soluble fiber can be beneficial.
Okay, thank you. This is just a question for clarification, please. So one of the earlier slides mentioned to eat apples with the skin, but then later said to avoid skin on fruit. So just wondering if you could clarify that, please.
Right. So we were talking about two different bowel issues here. When I talked about the apple with the skin, that's if you're having difficulties with constipation and you're not at risk for a bowel obstruction. So that's why this can be really confusing, because we're talking about constipation. We're talking about different things: constipation and bowel obstruction and diarrhea. For constipation, the skins and seeds may be helpful if you're not at risk for bowel obstruction. If you are at risk for bowel obstruction, you should take the skins and seeds off. If you're experiencing diarrhea, remove the skins and seeds.
Okay, thank you. That clarified that. Are flax seeds helpful in the prevention of constipation?
Yes, flax seeds would be considered fiber. So certainly things like chia seeds, flax seeds, hemp hearts, those kind of things absolutely may be helpful.
Okay. Do carbonated drinks help with minor constipation? And I think you may have touched on this.
I mean, I wouldn't say carbonated is going to be any more beneficial than any other fluid that you might be drinking, but certainly carbonated beverages, I mean, if that's something that you enjoy and like, and you're not experiencing gas and bloating with it, certainly you could include that as part of your fluid intake to try to manage the constipation.
Okay. Now, this is a question that goes back to when you touched on the homemade electrolyte drink. So the comment is that that's a lot of sugar in that drink. And is that okay to have on a daily basis for the average person?
Right. Well, the interesting thing here is it's exactly in the right proportion of sugar, electrolytes, and fluid that's optimal for absorption. And so that's the reason why there is sugar in there. I think you'll find actually when you actually make the drink, it's not quite as sweet as you think it is. But yes, again, if you're having issues with diarrhea and you're losing a lot of fluid through your bowel, definitely you need to replenish and replace those fluids. And an electrolyte drink can certainly help with that, because you're likely to absorb the fluid better than sometimes just plain water.
Okay. Makes sense. Okay, this is again just more asking for your feedback. So this person follows the BRAT diet: bananas, rice, applesauce, and toast after treatment. And online says that it's good for both diarrhea and constipation. So just wondering your thoughts on that, or the diet in particular.
Yeah, I mean, and this is where, like I said, it can be very confusing. The BRAT diet is typically meant to manage diarrhea. It's not meant to manage constipation.
Okay, thank you. Wow, you're flying through these questions. I have two left here. Would taking laxatives long-term be an issue?
I mean, this is, more of a medical question, but I would say if you're struggling with moving your bowels, and again, depending on what the cause of the constipation is. So we may be able to treat constipation in other ways, but certainly if you need to take a laxative to keep your bowels moving, that's very important, because if your bowels are not moving, that can absolutely lead to serious, other complications. So I would say as long as your healthcare team is telling you to take the laxatives, you should continue to do so. Don't be afraid. Like, it's so often that I see women who are afraid to take laxatives or don't want to. Same goes for Imodium, actually.
Right.
Any medications that's managing your bowels. So it is important that you follow the instructions from your healthcare team and to continue on with that.
Thanks, Robin. Okay, the last, they keep rolling in here. Does cheese cause constipation?
That's a good question. There's some people who would swear that it does, and it can be constipating. But what I often say is, how much cheese are you eating? If you're having a slice of cheese, or you're putting it on a sandwich or grating it and putting it a little bit in eggs, that is not likely, that's not causing your constipation.
Right.
So I always say, if you enjoy cheese and you like it, small amounts in your diet. Some people might be more sensitive, but it's not looking at one particular food. It's not the cheese that's the culprit here. We have to look at, what else you're eating and what medications that you might be on. So the short answer is no, but maybe.
Okay, it makes sense. Makes sense. Okay, so I think that is all the questions that we had. That was a ton of information, all excellent information. Really appreciate you taking the time to, I know we've gone a few minutes over, but thank you for answering those last few questions. That's all the time we have for today. So Robin, again, I just want to thank you so much for sharing your time and experience and expertise with us. We truly appreciate it. Before everybody goes, I just want to remind you all that we do have 2 sessions remaining in the Lunch and Learn session, so you can still register for those. Next week on May the 24th, we have complementary therapies with Dr. Linda Balmees. And then on May the 31st will be our final session, and that session is on pelvic radiation-induced bladder and GI side effects with Dr. Kakamanu. I'm not sure if I pronounced that right or not. And just a reminder that when you do register for those, if you can please check your spam folder, because your link to the webinar may also go to your spam folder. So finally, again, thank you all for joining us today, but your feedback is so important for us in helping to shape future sessions and future Lunch and Learns, or in person, hopefully one day. So if you could please fill in your evaluation. Michelle has included the link on the right-hand side in the chat function, but also we will be sending you out an email tomorrow. So if you could just take a moment or two to fill that out, that would be great. And that's it. So again, on behalf of Ovarian Cancer Canada and CancerCare Manitoba, we want to thank you all for joining us, and I hope you have a great rest of your day. Take care.
Bye, everyone.